Welcome to the lesson today. My name is Andy and I am a registered massage therapist. Today, together with Advanced Health International Institute, we bring you a series of courses that can help you learn or refresh your memory in anatomy. Anatomy is one of the most important core subjects for any healthcare discipline. And quite frankly, it is pretty awesome to learn about the body as well. Today's topic is general description of the gluteal region and its muscle. So let's get started. The gluteal region is bordered on the top of the iliac crest to the gluteal fold on the posterior aspect of the body. The pelvic bone is made up from three different bones: the ischium, the ilium, and the pubic bone. These three bones fused together at the acetabular fossa region. On this slide, shows you some important landmark of the pelvic bone, and you should get familiar with these landmarks. The muscle in the gluteal region mostly abduct, extend, and laterally rotate the femur in relation to the pelvic bone. The gluteal region interconnected with the pelvic cavity and the perineum via the greater and lesser sciatic foramen respectively. In this slide, you can see on the superior aspect is the greater sciatic foramen, and in the inferior aspect is a lesser sciatic foramen. They are divided by the sacrotuberous ligament. Let's talk about the muscle of the gluteal region. The muscle of the gluteal region is divided into two groups, the deep and superficial. The deep group comprises mainly of lateral rotator of the hip, include the piriformis, superior and inferior gemellus, obturator internus, and quadratus femoris. The deep group of gluteal muscle include muscle that can laterally rotate the femur in relation to the pelvic bone. The superficial group consists of muscle that extend and abduct the hip. They include gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia lata. The TFL muscle also acts to stabilize the knee through the use of the IT band. Now let's talk about the deep group of the gluteal muscle. The piriformis is the most superior muscle of the deep group. It is the muscle of the pelvic wall and of the gluteal region. The origin of the piriformis muscle is from the anterior aspect of the sacrum. The muscle passes laterally and inferiorly through the greater sciatic foramen, insert into the superior aspect of the greater trochanter. The action of the piriformis muscle is laterally rotate and abduct the femur in relation to the pelvic bone. The piriformis muscle is innervated in the pelvic cavity by the nerve to the piriformis, which is a branch from the S1, S2 spinal nerves. Let's talk about the obturator internus next. It is also a muscle of the pelvic wall and the gluteal region. The origin of the obturator internus is the medial surface of the obturator membrane and the bone adjacent to the obturator foramen. Its insertion is also to the greater trochanter. The tendon of the muscle bends a 90-degree around the ischium in between the ischial spine and the ischial tuberosity through the lesser sciatic foramen. Its action is to laterally rotate the femur and abduct the hip also, and its innervation is nerve to the obturator internus, which is also a branch from L5, S1 spinal nerve roots. Next one are the gemellus superior and inferior. So this is a group of muscle. The superior gemellus, it lies on top of the piriformis. That's why we call it superior gemellus. Gemelli mean twins in Latin. Its origin is external surface of the ischial spine, and the insertion is the superior surface of the obturator internus tendon along the tendon of the obturator obturator internis muscle or tendon, and attaches to the medial side of the greater trochanter. Its action is also laterally rotate, extend, abduct the femur. Its innervation is the nerve to the obturator internis, L5 to S1. The inferior gemellus. The origin is the upper aspect of the ischial tuberosity, and its insertion is inferior surface of the obturator internus, the medial side of the superior aspect of the greater trochanter, along with the obturator internus tendon. Its action is to laterally rotate, extend, abduct the femur at the hip joint, and it is innervated by the nerve to the next muscle we're going to talk about is the quadratus femoris. Now, when people talk about the lateral rotator of the femur or of the hip joint, most of the time people only talk about the piriformis muscle. But as you can see, there are so many other muscles that perform the same function of the piriformis. So, if there is a weakness in lateral rotation of the hip, now you know it's not only the piriformis muscle for us to be considered, but there are other muscles to be considered as well as other type of other origin of innervation as well. So the quadratus femoris, with the origin of the lateral aspect of the ischium, just anterior to the ischial tuberosity, it inserts into the intertrochanteric crest of the proximal femur. Its action is laterally rotate the femur, and it is innervated by the nerve to the quadratus femoris. Let's talk about the superficial group of muscle. Let's start with the gluteus minimus. Its origin is external surface of the ilium between the anterior and the inferior gluteal lines. Its origin is anterolateral aspect of the greater trochanter, so it enters into the greater trochanter. The action of this muscle is to abduct the femur at the hip joint, stabilize the pelvic during stance phase of gait, prevent the pelvic drop on the opposite side during gait, and medially rotate the thigh. So this is the gluteus minimus and gluteus medius is very important muscle in gait. Gait is how you walk. Okay, so there is a special test, quote unquote. It's called Tredan-Lambert sign, which when you observe a person's gait, you're gonna notice during stance phase, which is weight bearing on the one limb, you're gonna see the pelvic gonna shift onto the one side due to the weakness of the gluteus medius and the gluteus minimus. They are unable to keep the pelvic in position while walking. That's why the shifting of the pelvis is there. Okay. It is innervated by the superior gluteal nerve with the roots from L4 and S1. Okay, the next muscle is the gluteus medius. The origin is external surface of the ilium between the anterior and the posterior gluteal line. It is just superficial to the gluteus minimus, so it's on top of the gluteus minimus. Its insertion is the lateral surface of the greater trochanter. The action of this muscle is to abduct the femur at the hip joint, stabilize the pelvic during stance phase of gait, prevent the pelvic drop of the opposite side during gait, and medially rotate the thigh. So its action is almost, identical to the gluteus minimus, just bigger and more superficial. Okay, and it is also innervated by the superior gluteal nerve. Okay, the next muscle of the superficial group we're going to talk about is the gluteus maximus, and this is one of the biggest muscle in the body. Okay, its origin is the fascia that covers the glute medius the external surface of the ilium behind the posterior gluteal line, the fascia of the erector, the common fascia of the erector spinae muscle, which is the extensor of the back, okay, the dorsal surface of the lower sacrum, lateral margin of the coccyx, external surface of the sacrotuberous ligament. The insertion is the posterior aspect of the IT band and the gluteal tuberosity of the femur. The action of the glute max is to extend the femur, laterally stabilize the hip joint, and the knee joint, laterally rotate and abduct the thigh. How does the glute contribute into stabilizing the knee? Well, because a part of the glute max insert into the IT band, and the IT band travel along the lateral aspect of the thigh and insert into the lateral aspect of the tibia. The landmarks named the Gerdy's tubercle, and because of that type of insertion or that type of attachment, the glute max also work in stabilizing the knee. Okay, and the glute max is innervated by the inferior gluteal nerve, which has the root from L5 to S2. Okay, and the last muscle, but not least, so this muscle is the, well, some people consider it is a hip flexor. So the TFL, or the tensor fasciae lata. The origin of this muscle is on the lateral aspect of the crest of the ilium, just between the ASIS and the tubercle of the crest. So the tubercle is the portion that is enlarged along the iliac crest. Okay, it insert right onto the IT band, and through the IT band into the lateral aspect of the knee, and therefore one of its action is to stabilize the knee while the knee is in extended position. It is innervated by the superior gluteal nerve, which has the root from L4 to S1. One of the note that we should know is that many important nerves in the gluteal region are in between the deep and the superficial group of muscle. And why is this important? So you have the superficial group, which include the glute max, glute medius, glute minimus, and the TFL. And then you have the deep group, which is the lateral rotator. So now they are one on top of another, and the nerve just travel in between. So the nerve is kind of like being wedged in between the two groups of muscle, and between two moving structure, there is a possibility to develop fascia adhesion and things of the same sort. So that is why it's important for us to know that the nerves are passing in between these two groups of muscle, and there is a potential of adhesion that, you know, put pressure on a nerve and creates neurological symptom. Okay, so that's it for today lesson. So today let's just recap. Today we talk about general description about the gluteal region and its muscle. So in the next video, we're going to talk about the nerves of the gluteal region and the blood vessels, so artery and veins of the gluteal region, and possibly the lymphatic system of the gluteal region as well. So thank you very much for watching again, and I hope to see you in the next lesson. If you like the video, please don't forget to smash that like button and subscribe to our channel for more amazing video.